Hi, Joe Green from the Louisville Hip and Knee Institute. So sometimes the question is, how do I do my pre-op preparation for my knee replacement or my hip replacement? And really our goal here is that our team will help set up laboratory values as well as EKGs. If we need to talk to some of the specialists involved in your medical care to make sure you're safe for surgery, we'll set that up. That's called a pre-op clearance. Now, if we're going to talk about physical exercise, it's very hard to exercise when you have a really bad hip. With a bad arthritic hip or avascular necrosis or a hip issue, it's very hard to exercise to get the muscles stronger. So our recommendation for that is just to try to take it easy, keep the pressure and weight off of your hip. The knee, sometimes you can actually strengthen the muscles around it before your surgery. We recommend quadriceps muscle strengthening if you can. You'll get a joint replacement booklet that shows some exercises, but I'm a big fan of a straight leg raise. You keep the leg completely straight, and as you bring the leg up, you will feel a burn in the quadriceps muscle. This is best demonstrated on our booklet as well as some of our video content with physical therapists doing some guidance.